So I really want to thank everybody for participating. And as I said, I'm Teresa Kittredge, founder of 100 Rural Women. In a nutshell, who we are is we're an organization that wants to figure out how we can better connect rural women, how we can better support each other as rural women, and how we can get more rural women in decision-making leadership roles. So that's really the essence of who we are. And I'll tell you what, 2022 was a growth year for us and a big year where we learned more about how we could be an organization that could best serve 100 rural women. And I just want to make a quick little shout out to Delaney Anderson, who's joining us this morning. Delaney was our graduate student last year and led our 100 meetings that we facilitated them and did all the research that we conducted over this across the state. And again, we did those virtually. So we engaged over 2,000 women, and it's just been an incredible year. So Delaney is off to medical school now in Madison. We miss her, but we're so excited that she has chosen rural health to practice in. So I love it. So a little bit more logistically, so 100 Rural Women, our breakfast club, I told you about that. I'm so excited that we're going to be able to talk about this project today. I met Katie, probably a year and a half, 2 years ago when this project was just sort of a thought in infancy. So I'm really excited to learn how it's developed. And I just want to do a couple of quick intros. Staff that has joined. Lindsay, can you introduce yourself?
Yeah, sure. My name is Lindsay Rumling. I'm an econ management double major and a senior at the University of Minnesota Morris. I started interning in the summer and I worked primarily on the Civic Mentorship Network, and I'm excited to be here today.
And thanks, Lindsay, for introducing yourself. And we'll talk more at the end about some of the projects we have going, but what we learned in those 100 meetings, and Delaney can attest to this, we had 6 major themes. Mentorship was woven through each one of those themes. So mentorship is a big focus for us in 2023. And we're going to be doing mentorship across all sectors, but we're starting in civic. That's sort of that's where our jump off place is. So excited about that. And Delaney, do you want to just introduce yourself quick, even though I blabbed on about you, but
I knew this was coming. Good morning, everyone. My name is Delaney Anderson. I use she, her pronouns, and spending almost 2 years with 100 Rural Women during my Master's of Public Health degree was such a great part. And I'm currently 6 months into medical school here in Madison, and I'm a part of the Wisconsin Academy for Rural Medicine. So it all weaves together, and I'm so glad I had the opportunity to come and join y'all today. This has been such a great community. So lovely to meet you all and glad to be here.
And of course, Delaney knows me because I always have to put people on the spot. But yeah, I just want to welcome everybody. And just to let you know, 100 Rural Women is based in northern Minnesota. We're just north of Grand Rapids, Minnesota, about 35 miles. And just really happy to have you all here again today. And I'm going to hand it over to Alexa to take us forward.
Well, it is so nice to see all of you guys this morning. I'm just going to go over a couple Zoom etiquette things. I'm sure we've kind of been through it before, but just in case we need any reminders, try to keep yourself muted if you can during the presentation. And then if you have any questions at the end, we will be holding a Q&A session, and you can either raise your hand in the reactions tab on the bottom left. You just click that. There's a little button that says raise hand. And then we can call on you. If you feel like you aren't really wanting to speak up, you can shoot me a message. I'm Alexa in the chat, and then I can go ahead and ask it for you. So without any further introduction, I'm actually going to hand it over to Ann, Leah, and Katie, who are our speakers today. I'm going to put their bios in the chat, but I'm going to let them introduce themselves because they can just do it better than I can. So I'm going to hand it over to you, Katie.
Hello, my name is Katie Rydberg, and I'm the program manager of the University of Minnesota Rural Health Program. I oversee the operations and development of Project Reach. I'm so excited to be here with you all, and I'm so grateful to 100 Rural Women for giving us a platform to talk about Project Reach. 100 Rural Women has just been such an amazing partner in the development of Project Reach and in spreading the word about the program. And so I'm very lucky to be joined here by my colleagues, Leah and Ann. They are former participants from our first cohort of Project Reach. And so Leah and Ann, you just want to quick introduce yourselves and then we can hit the ground running here.
Sure. Would you like me to go first? Yeah. Okay. My name's Leah Lehtola. Great to see all of you this morning. I am based or live in Montevideo, Minnesota. It's about 2.5 hours straight west of the Twin Cities on Highway 7. Our population here is about 5,500 people. Born and raised here, went to school in Mankato at Minnesota State, have a degree in community health. And Nicole, you too?
I live in Mankato and I'm from Mankato.
Oh, okay, wonderful. So yes, I work for CCM Health. It's a local healthcare organization here in town, hospital and clinic. We are independent in that we're 50% owned by the county and 50% owned by the city. My role here at CCM Health is I'm the Community Health and Wellness Center Director. So I'm the director of a fairly new, we've been open for about 2.5 years, wellness center, hospital-based wellness center. So we've got a fitness center, indoor playground, some meeting space, demonstration kitchen, all sorts of fun things going on here. But I was a Project Reach participant last year along with Ann, and I'm excited to share a little bit about my experience and some of the highlights I had as a participant. So happy to be here today.
Okay, I'll jump in. I'm Ann Bussey. I live in Side Lake, Minnesota. It is a lakes community north of Hibbing and Chisholm on the Iron Range. I actually grew up and lived in Duluth my whole work life, and I was retired as a vice president from Essentia Health. And I currently sort of made up my own new title as a retired person. And you find you just have to do that or you become very invisible as a retired woman. So I call myself a thriving and longevity advocate for Minnesota's rural older adult population. I volunteer in a lot of organizations. I'm an Arrowhead Area Agency on Aging Arrowhead Changemaker, which means that I'm a core person on their age-friendly initiative, working with all the people at the Arrowhead Area Agency on Aging, which is right up, all of Northeast Minnesota again. I'm also a volunteer with the Duluth Area YMCA, and I have been advocating for healthy aging strategies through its senior members for a long time. I was appointed to the Minnesota Rural Health Advisory Committee in 2016. I served as the chair last year. I have 1 year left on my term. I also serve on the Fairview Range Community Advancement Committee, and I'm on their foundation. I was so excited to be a fellow in Project Reach. That has been a whole way that as an old person I can belong, and we'll talk about that later. And that's the key points. Thank you.
All right, I'm going to go ahead and share my screen and get us started here with our slides. I will try to go through my slides as quick as I can so y'all can hear from Leah and Ann and their experiences. So can you see my slides okay?
Yeah.
Awesome. Perfect. So Project Reach stands for Rural Experts Advancing Community Health, and this is a community-based initiative of the University of Minnesota Rural Health Program, which is funded by the Clinical and Translational Sciences Institute and Office of Academic and Clinical Affairs at the University of Minnesota. And we launched our first cohort of Project Reach in the summer of 2021. And so Project Reach is a program that provides health policy and leadership training program to community leaders in rural Minnesota. And we use the term community leaders very loosely, as this really encompasses a number of different kinds of people, but basically anyone living or working in rural areas in Minnesota that want to do more in their community to impact health policies and therefore creating more positive health outcomes in their rural Minnesota communities. And I'll go over exactly what the curriculum covers in the program a little later, but in summary, participants receive training and technical assistance around how to identify and use research and data around a particular health issue in their community, learn more about the health policy process and policy communication, and how to engage with their legislators or other local decision makers about these health policy issues in their communities. Throughout the process, participants are connected with a network of mentors, resources, and expertise here at the university, but also from other people and organizations across the state who are doing amazing things to improve health outcomes in rural Minnesota communities. And so our team believes that people living in rural communities are the experts in their communities, and they know what the problems are, they know what the strengths and weaknesses are. So combining their expertise around their communities and with that of those working in the health policy sphere at the University of Minnesota and others around the state has made for such an incredible knowledge sharing and growth opportunity, but for both our participants, living in rural Minnesota, as well as for us at the university. And so it's been a real opportunity to create real impact through policy change in local Minnesota communities. Trying to get my slide to go forward there. Oh, there we go. Perfect. So the program is a year long and starts and ends in the summer. In the first half of the program, participants choose a health policy issue in their rural community and use local data to be able to describe and frame the problem at hand. And then in the second part of the program, participants develop a policy proposal on their chosen health policy problem and share that with their state legislators or other local decision makers. So far we've had one cohort complete the whole program and another cohort that's currently in the middle of the program right now. And both cohorts have had 3 participants from across the state. We do have the goal of adding on more participants in each cohort as time goes on. The updated application information just went live on our website last week. So we are currently actively recruiting for our 3rd cohort. As part of the application process, we have an RFA and an interest form on our program website. Interest forms this year are due by Monday, February 20th. The interest form just asks for people's information, asks some basic questions regarding the rural community they live or work in, and what health policy issue is of interest to them in their communities. We use these interest forms as a way to screen interested people just to make sure that they would be a good fit before sending them the link to the full application, which those full applications are due then by April 3rd. And so in the past, we've had some issues where people who submitted interest forms didn't actually live or work in a rural Minnesota community or didn't really understand the health policy based nature of the program. So it's just important for us to kind of weed out some of those people because we don't want to waste people's time having them complete the full application. We also have a frequently asked questions document linked on our website as well, where we outline some additional criteria regarding who's eligible to participate. And we do share our recruitment information and interest form information with our partners across Minnesota, both at the university and organizations across the state, such as 100 Rural Women. Once people fill out the interest forms and the applications, ultimately our selection criteria for participants really comes down to the relevancy of the policy issue that they want to address, racial and geographic distribution of our potential participants, and the potential impact that their participation in the with that particular health issue would have on health impacts in their community. And I also want a quick note that participants do receive a $1,200 stipend for participation in the program because it is a big commitment and a lot of time and effort, and we want to honor people's time and effort in this program. And we also cover costs for any travel to St. Paul up to a certain amount, and also funds for additional professional development opportunities. So in terms of curriculum, here we have a list here of different topics that we cover in the program. These topics really encompass walking through the policy process. We hold monthly sessions via Zoom. They're about an hour and a half long, where we either have a faculty or staff member from our team leading a discussion on a particular topic, or we'll have a guest speaker who is very knowledgeable about a particular area of the policy process to lead the session. We've been so lucky to have some amazing guest lecturers for Project Reach. Some of our guest speakers have included Mary Gilbertson, who is the former Healthcare and Aging Outreach Director for Senator Tina Smith, Steve Gottwald, who's the director of the Minnesota Association for County Health Plans and a former Minnesota state legislator, Molly Malone, who I saw Molly on this call here, who's a county commissioner from Murray County, Minnesota, and Erica Barnes, an administrator for the Minnesota Rare Disease Advisory Council. Outside of these group sessions, participants also meet one-on-one with mentors, who we call learning partners, and apply what they've learned in their group sessions to the health policy issue in their rural community. The learning partners help them walk through the deliverables of Project Reach as it relates to their local health policy issue, such as identifying data to support their issue, developing their policy proposal, coming up in an agenda to meet with their local legislators or decision makers in their communities. Our current learning partners are all faculty and staff members at the University of Minnesota, some of whom are internal to our team, but also pulling from others who are members of the University of Minnesota Rural Collective or our colleagues at the School of Public Health. We match up participants with learning partners based on the health policy issue that people are interested in focusing on, the rural communities people are from, because some of our learning partners happen to be from the same rural Minnesota communities as our participants, and other expertise that the learning partners and participants have that are relevant. So our three participants from our first Project Reach cohort were Ann Bussey from Side Lake, Leah Lehtola from Montevideo, and Adam Padovic from Grand Rapids. And I'll let Ann and Leah share more about their work and experience in the program momentarily. But Ann did such incredible work in the program, focusing on addressing social isolation in older adults in the Iron Range area. Leah worked extensively with partners in her community to start the process of developing a local mental health coalition as a way to address high rates of suicidal ideation, particularly among high school girls in her community. And then the other participant in our first cohort, Adam Padovic, he's a pharmacist from Itasca County, and the work in Project Reach, he focused on access to prenatal care for Indigenous women in Itasca County. His work in Project Reach has led him to be a leader of a DEI work group for Itasca Medical Care, which in the last several months has developed a strategic plan to promote equity and inclusion and enhance culturally appropriate care, particularly for Indigenous people in Itasca County. And he continues to engage with stakeholders from local tribal communities and various sectors of Itasca County to improve systems and access to healthcare for Indigenous people who need maternal and child health services. Just a few more slides here on my end. So at the beginning of our first cohort in July 2021, and at the end of the program year in June 2022, our three Project Reach participants completed a skills assessment. And this skills assessment aimed to evaluate the competency levels of each participant around skills related to the program. And by completing the assessment at the beginning and the end of the program, we were able to see the growth in skills for each participant and collectively as the cohort. And this figure here just demonstrates the growth and competency for each skill set for our first cohort collectively. And overall, all three participants increased their skill set competency by over 50% over the course of the Project Reach program year. And participants demonstrated the most growth in communicating effectively with legislators and policymakers by an increase of over 71%, which I think is amazing. And so my last slide here before I hand things over to Leah and Ann, our second Project Reach cohort began this past summer. Our three participants are Gina Kujava from Halleck, Minnesota, Erin Schwab from New Ulm, and Jody Roberts from Grand Marais. And so Gina is the director of Kittson County Public Health and is focusing her efforts in the program on addressing substance use in Kittson County. Erin Schwab is a public health advocate from Brown County. And she's focusing on addressing high rates of adverse childhood experiences in her community. And Jody is an early childhood advocate who is focusing on access to healthcare services for children with special health needs in Cook County, Minnesota. And so currently in the program, they're all in the process of developing their policy proposals, and that they'll be sharing with their legislators or other local decision makers in the next few months here. So now I'm going to hand things over to Leah to share her experience in Project Reach.
All right, thank you, Katie. So yes, here you can see on the slide, I've got about 5 bullet points that just kind of speak to the highlights that I identified, wrapping up with Project Reach. So I'm not sure, Katie obviously mentioned what the policy issue or the health policy issue that I focused on, but I think it's worth noting that when I entered the program, I didn't have any idea of what I was going to identify as my policy program. So I'm happy to hear that now participants or interested parties can indicate that on their interest form. Not that I feel like it was a bad thing, because actually it's one of my highlights here that you can see the 4th one down, just learning so much about my own community. So I went into Project Reach with a very open mind about what I was going to focus my policy problem on, or my topic, which really did encourage me or lead me to really dive deep into our community health needs assessment and our county health rankings to learn about my community on another level. So number 4 there, learning so much about my community. I ultimately chose youth mental health as my topic after learning specifically that 11th grade female students who report having long-term mental health, behavioral, or emotional problems has more than doubled from 2013 to 2019. And this is from the Minnesota Student Survey, which maybe they actually just released their newest results here in 2022 last month. So, and that number of course has gone up. So additionally, 1/3 of 11th grade females in the Countryside public health area, which includes my county, Chippewa County, had seriously considered suicide. So that is what I chose as my policy problem or my health issue. And of course, I've been looking at the Minnesota Student Survey results as I prepare for a meeting later this week, actually, with our group that's going to be focusing on this. And it's now 45% of 11th grade students, female students, reported long-term mental health, behavioral, or emotional problems. So that's up from the 35% in 2019. And a comment that I had read from Jan Malcolm, Minnesota Commissioner of Health, said, "It's clear that this is a crisis in Minnesota. Minnesotans, lawmakers, and families need to focus resources and attention in and outside of schools to give our children and their families the connections, support, stable environments, and opportunities they need for a sense of well-being about their lives and futures." So that's all very unfortunate data, but it's helpful in driving this proposal. So number 1 there, the first bullet point, developed relationships with key stakeholders that will benefit future work for years to come. So Project Reach really led me to reach out to key stakeholders in my community that I otherwise maybe wouldn't have as much of a push to engage with. Now this includes a city manager, public schools superintendent, chief of police, county mental health workers, and more. So just the opportunity of reaching out and saying, "Hey, I am a participant in this Project Reach program. Can I sit down and meet with you to talk about this topic?" It just gave me that opportunity and that push to really get in front of them and talk about this. So number 2 there, engaged in invaluable discussions with key stakeholders that will benefit, engaged in invaluable discussions with community leaders. So while those meetings that I arranged were of course focused around the topic of my policy problem, other topics of conversation have developed, and it feels as though through these meetings we've really unlocked potential for collaboration in many different areas, and this has been a huge help in the community health work that I do for CCM Health. I already mentioned this, but learned so much about my own community. It was really enlightening to learn about all of the great things that local groups were doing, but there was an evident lack of collaboration between healthcare organizations, the school, the county, and local behavioral health providers. As I listened and learned in these meetings, it was my impression that these groups were not intentionally working siloed. They were just doing the best they could to respond to this issue the best they could and as quickly as they could. So number 4 there, number 5, new skills, confidence, connections, and resources. So That's probably one of my biggest highlights from my experience with Project Reach. I've got an entire folder of, documents, links, contacts, all that were added to my toolkit, thanks to Project Reach. So it truly was a privilege and an honor to learn from the experts on this team that were all, mentioned in that previous slide. And I just want to end by saying that I have a new sense after my experience with Project Reach. I have a new sense of confidence and a new viewpoint that you don't have to be a subject matter expert to influence change. And that's probably one of my biggest takeaways. Many times I think that being a rural health leader, or living rural and being a leader, means that you wear a lot of different hats. And sometimes wearing a lot of different hats feels like you don't get to, or for me at least, don't get to really dial in your efforts to make a large impact. But over the past year, I've realized that those small drops in the bucket or actions and efforts really do add up over time, and they will make an impact. So that's a little bit about my experience. I highly recommend the program. I had a great experience and have taken so much from it, and will forever be appreciative and grateful for the opportunity.
Thank you so much, Leah. Now I'm going to pass things over to Ann.
Sure. Thanks, Leah. It was, we didn't get a chance to visit much as members of the cohort. We were pretty aligned with our researchers and with Katie. And so it's really interesting even now to hear what Leah has done with her policy proposal and action. So thank you.
And if you I can quick interject. We have changed that a little bit in our new cohorts. We do have quarterly sessions where outside of our monthly discussions and everything, and one-on-ones with our with learning partners, for our participants to have more of like time to collaborate and chat with each other, and get to know each other and have more of that like cohort building. And so just want to quick interject there.
Well, it was fun being the first guinea pigs in this project. So I think what I want to say, that as a woman who grew up in the 60s, when women started burning bras and women really didn't work outside the house, I had one friend whose mother worked, and there was like only one child care place in Duluth at the time. I mean, it was just a whole different society. And so when I went to college in the late 60s and then graduated, it was a time for women to enter the workforce. And I know even my parents, when I got pregnant, they said, well, aren't you quitting work? And I said, well, I don't think so. And childcare was hard for a good decade because there wasn't childcare in the 70s. And so my whole career as a woman, first as a professional person, I was a medical technologist in a hospital, and then advanced in the leadership and ended up retiring. I think the last third of my career was as a vice president, as Essentia grew from just a very small hospital and clinic to be a multi-state system. And my career just grew as Essentia grew. But what I found, even as a new woman leader, that even most of my career was about fitting in and not really about belonging. And, as so many young women on this call, I don't know if that's still your deal or not, but would love the dialogue about how women have changed. So then as a person in my 70s, again, it is about older women are so invisible in our communities, especially in our rural communities, who really want to recruit families and children. They're looking at the future, and yet they have these growing populations of older people, and we're considered kind of the dregs and the baggage, instead of looking at us as assets. And so that's the mindset that I had when I applied for Project Reach, and I thought, who's going to invest in somebody who's 75 years old? So I thought, well, it'd be an interesting thing if I got in, but I really was surprised when I was accepted. And what I found is that project really gives women the legitimacy, opportunities to develop meaningful policy proposals, you know, the access to the seasoned researchers and tools and advocacy to build a network. My policy proposal came out of a volunteer job during the pandemic. I've been a volunteer for older adult activity programs on the range. And so I've been a member of the Mesabi Y. And when the pandemic hit, we have this large activity program in Hibbing and wanted to figure out a way to just keep that camaraderie, the social part of it, keep us connected, and was really concerned that this long haul of the pandemic was the downside of social isolation for aging people is really a significant thing to think about. And so I approached the Y and asked if they had if they had emails, if all the people they registered had emails, and they had a database of 1,400 senior members, and less than 50% had an email associated with their registration. So when I thought about what did I want to focus on for Project Reach, it was digital inclusion and digital literacy for our rural older adults. That, you know, I knew from my career that, you know, we worked in paper, but somewhere in the 90s, early 2000s, that we became, you know, everything became electronic. And so I had enough of a background, but I knew that 10 years out of retirement already, I knew I didn't have an IT department, and retirees don't have an IT department. So what do we do for community older adults to keep them connected? So in doing all my research, I came across the Library Services and Technology Act from 1996, Bill Clinton, where all libraries receive federal money to be the technical centers for communities. And so when I looked into it, it seemed like our libraries in Minnesota have always focused on family and children. So I found a number online and I called it for the Minnesota Library Services and left a message that I wanted to talk to somebody about the LSTA Act. So I hung up the phone, and 15 minutes later, I get this call back from this woman who said, nobody has ever called the library and asked about the LSTA Act. So we're really curious, what are you doing? And so my friend Hannah Buckland was my partner for the whole rest of Project Reach. And so we worked closely with the library. My proposal was that our state library system of 336 libraries, every rural community almost has a library, that they become the IT department for retirees, that they focus their next 5-year plan on older adults as well as family and children, so that they truly can take that federal funding they get and try to move some of it into keeping to connect older adults and teach them, the ones that don't use technology yet, and for people like me to keep me up to date. So Hannah has now moved to be the digital equity lead for the state of Minnesota. So she's working with that whole department, you know, with all that information from my policy proposal on the need for digital inclusion for our older adult population. And through all of this, one of our stakeholders that Katie had scheduled for us, I gotta watch my time here, he asked each of us to give a short summary of our projects. And so when it was my turn, I talked about digital inclusion, digital literacy for rural older adults. And he went right to, well, what about telehealth and getting old people patients, blah, blah, blah. And you know, I answered his questions. And after I thought, it's interesting that everybody immediately goes to old people as patients or we're in need of support and services. But nobody's really looking to support, no, that's not a good word, to really encourage older people to thrive in longevity, and found that our outcomes for aging are all support and service and health goals, and they're not quality of life goals. So I did research on quality of life goals and came up with 5 that we should be focusing our aging initiatives on. And they are that our communities are centers for opportunities for aging. And the 5 things that we should be thinking about is purpose, personal agency. So that's this core thing where you want to be able to make your own decisions. You know, it's the degrees of freedom in your life, and you don't want to lose that. It's social connectedness and engagement, it's activity, and most importantly, it's belonging. So I found that the narrative on aging was so terrible that even this person that's supposed to be an esteemed resource from Project Reach went right to older adults as patients, you know, and it's back into that paradigm. And so I talked to the researchers, my 2 researchers, and said, you know, I think I need to do a fact sheet. I have so many facts about aging, and it tells a different story. And, you know, they went back and forth and said, are you sure you want to spend all that time on this? And I said, you know, I don't think I'm going to have a chance out there to advance anything unless I can address that narrative. So I'm sure I spent a month trying to put this fact sheet together. And the reality is that this fact sheet has taken off way more than my policy proposal, which has been accepted by the library and they are moving forward. But what's out there is this fact sheet on aging. In fact, I'm doing a webinar next Monday. I'm recording it with a couple of the aging services on just the fact sheet, because they would like the legislature to consolidate a lot of our aging to include healthy aging. We have no healthy aging policy that is funded in Minnesota. So a couple things, if you're all rural women, I'd like to just read a couple of facts off of this fact sheet, if you would be patient with me. Nationally, there's more aging women than men, 25% at age 65 and 78% over the age of 85. So when we look at our rural communities, we see lots of women, and that's because that's what the demographics are. Greater Minnesota is home to a larger share of older adults, and 70% of aging women live in Greater Minnesota. And Greater Minnesota does have a couple metro areas, but it is essentially, aging is about rural women, and they're poor women. There's twice as many women that live on Social Security alone compared to men, 33% to 17%. And so aging is about rural, and it's about poverty, and it's about women. And then ageism and sexism results in 2 times more older women living in poverty than men. And again, with 33% of aging women relying on Social Security compared to 17% of men. So I think what Project Reach did for me was give me a voice. I'm now the token older person on everybody's committee. And I ask, my key thing is that every community committee should figure out how to nurture and recruit older people to be on committees. We are a population where everybody else makes decisions for us. And that's not okay. And with the baby boomers retiring, we've changed the world forever, and we're just not going to put up with that. So if you're working on aging at all, you got to figure out how to put old people on there. Project Reach, I've gotten stuff printed because of Project Reach. You know, we were supposed to write an op-ed that was part of an assignment, and I sent mine to the Star and they didn't print it. So, you know, being somebody that's tenacious, too passionate, I'm sure I drive people crazy, but that's okay. So there was an editorial. I'm reading the paper. I get a Star online. So I'm reading, and it's about some woman who's complaining about how she's older and that why are all the Target ads online, and she wants her newspaper back. So I redid my op-ed piece that I had written for our assignment and did it in response to the woman who, you know, talking about how virtual is a new reality, and they printed it. So and then the Duluth paper also printed my op-ed. So I think that Project Reach really helps give you the skills to at least even try that, but also gives you the legitimacy that they're going to look for somebody like me. Being a Project Reach fellow was much more considered than I was just a citizen on the Iron Range. So I think that's pretty much what I wanted to say. I would encourage your organization to really consider participation in Project Reach, because I think women still don't have the voice we should have, that we've gotten so much better at how we behave, but I still think women have trouble belonging. And that truly tells you if you are integral to a table of leaders. So thank you for the opportunity to talk about our projects today.
Thank you so much, Ann. So just want a quick end here. I have my contact information here if anyone has any questions outside of, we have time to answer questions right now, but if anyone wants to get in touch about Project Reach or has any additional questions later on about the application process or any additional details about the program itself, I'm happy to answer those. And so there's my email. So yeah, we're happy to answer questions at this time.